In other news, the issue of healthcare financing has been a long-standing concern. Today, the Ministry of Health met with technocrats to discuss ways to enhance domestic funding and address the existing deficit. Currently, the country falls short of allocating 15% of its budget to healthcare while grappling with a decline in donor funds. Here's Beldin Waliaula with outcomes of that meeting.
In an effort to combat the dwindling donor funds, Kenya convened a high-level meeting to explore strategies for boosting local financing and ensuring sustainable healthcare funding. According to Anne Waiguru, the chair of the Council of Governors, it's imperative for Kenya to improve its healthcare service delivery. She emphasized the need for increased investment in mental health and highlighted the agreement among governors to ring-fence funds meant for hospitals.
As fertility declines and Kenyans live longer, we have begun to see a dramatic improvement in the dependency ratio, with the proportion of working-age Kenyans growing much faster than the young and elderly populations that depend on them. As such, we need to ensure that our health services are responsive not only to the younger population, but also to senior citizens.
In the fiscal year 2023-2024, the Ministry of Health was allocated 141 billion, which is a decrease of 5.6 billion compared to last year's budget. In response to this, the government argues that the current allocation is sufficient for the ministry to carry out its activities. Nearly half of Kenya's health budget is funded by the government, with 26% funded by Kenyans through out-of-pocket expenditure and approximately 20% coming from donors. Health experts have urged the government to increase its investment in healthcare to reduce reliance on out-of-pocket spending.
Knowing that there's likely to be perhaps reduced funding in this area from some of our partners because of where we are and maybe some of the things that are happening globally, I think then that special attention of further mobilization of domestic resources for funding becomes extremely critical.
We now have Afya Bora Mashinani, which is a primary healthcare model that focuses on prevention as a resource mobilization tool.
To promote primary healthcare and achieve universal health coverage, the government has committed to recruiting 100,000 community health workers who will receive a stipend for their services.
We are now championing the rollout of UHC through community health promotion, which is largely financed through domestic resources. This focus will move us all from disease firefighting mode towards prevention of disease and promotion of healthcare.
Beldin